keep mobile phone inside. Don't keep outside. Please listen. Very nicely. Cigarette smoking. Check. So this is the condition, plantar fasciitis. Okay. So we're going to see the special test. The special test name is windlass provocation test. So the patient standing like this and bending, and great toe should be lifted up. When great toe lifted up, patient will get pain. So because plantar fascia is here, starting from calcaneum, this is going to each toes. So when you extend, when you stretch the plantar fascia, they will get pain. Usually, if patient having plantar fasciitis, they will have pain in here, medial aspect of the skin. They have pain here, right? So when you do this particular stretching, so this particular structure, fascia will get stretched. When fascia is getting stretched, of course they will have pain. So palpation, whenever you get to any patient with plantar fascia, palpation you can see here. I will show you here for video, right? So here, the fascia starts from calcaneum. It will go up to the toes, right? Balls of the toes. So one branch will go here, another one go here, another one, each toes go one. But palpation should be done here. Here, this is the area of pain, symptoms they will get. So this is a special test, windlass provocation test. Okay, only one special test for plantar fasciitis. Then if you see treatment, number one, to decrease pain and promote healing, you can apply ice massage. You can see here ice massage. It can be given ionotoporosis. What is ionotoporosis? It is introducing, right, some chemicals, right, medications or chemicals into the skin. So by the medication or chemical, the inflammation will heal. That is called ionotoporosis. Then you know very well therapeutic ultrasound. So you can see where ultrasound is given. See, ultrasound is given here. Everything is here. You can see this is the left leg, this is the toe. Here is the toe, right? Toe side, here medial side. Ultrasound should be given where? In the medial side. You can see here low level laser therapy. The laser therapy also given here only, where in the medial side of the foot. Then contrast bath. What is contrast bath? There are two vessels, two plastic dabbas, plastic vessels. This is ice. This is ice. So one is cold water, another one is warm water. So cold water and warm water, right? So dipping the leg alternatively, right? That is 3:1 ratio. 3 minutes warm water, 1 minute cold water. 3 minute warm water, 1 minute cold water. 3 minute warm water, 1 minute cold water. Like that 3 times. So one session is 4 minutes. So 4 into 3, 12 minutes. Finally one more warm water, 3 minutes, total 15 minutes treatment. So that is contrast bath. Then soft tissue massage using our thumb, right? Using the thumb, massage can be given like this, soft tissue massage, right? Soft tissue massage, that also will promote healing. Then symptomatic care, so rolling, pin, cork, Coke bottle, using the Coke bottle, then ball, frozen juice can at base side for arch roll, stretching prayer to weight bearing. So all this, right? So you can see here, this is the food. So this is the Coke bottle or water bottle, rolling the bottle, then you can see rolling the ball, right? So when the roll, the fascia will get stretched. There is another ball, frozen items you can apply, then another rolling material, you can see there, one more rolling, right? You make chapatis, puris, roti, right? The rolling ball can be used. So to increase range of motion and strength, you can see here stretching can be done. Soleus stretching, right? Soleus, first do soleus stretching, the knee should be flexed. For soleus, this is back like this stretching. Knee should be flexed. But to do gastrocnemius, knee should be straight. That's what going front. Going front is for what? Gastrocnemius. Going down is for soleus. Then intrinsic muscle stretching. You can see only toe making extension. Sitting like this, making toe extension like this. Intrinsic muscle stretching. Toe like this, extension. Toe extension. Then plantar fascia stretch. standing on the foot, this steps, edge of the steps and lowering down. So that will give plantar fascia stretch. You can see here, this part touching on the step. The remaining this part of the leg is not touching the steps. Then tibialis, right, posterior stretch. You can see pulling the front portion of the foot or anterior portion of the foot, right, pulling the tibialis posterior stretch. Tibialis anterior stretch. Tibialis anterior stretch can be done like this. Then peroneal muscle stretch. Peroneal muscle stretch. Peroneal muscles are this side, lateral side. So doing inversion by himself. Peroneal muscle stretch. All stretching require this particular problem. Which problem? Plantar fasciitis. These are the extrinsic muscles of the foot. Then strengthening can be done like the single leg, toe curling, right? So toes, pulling some seeds, cloth seeds, the toes pulling. Toe has to pull the cloth seeds. Then tennis ball massage. So intrinsic muscles of the foot. So using the tennis ball and rolling front and back, tennis ball massage. So manual therapy to calcaneum, talocalcaneal joint. So here, come here. No, go. Side leg. So this leg, upper leg should be used. So here, hold, stabilize here, calcaneum here, right? We'll do, right, this holding, traction and do which one? Eversion, glide here, calcaneum, right, mobilization. So this mobilization will make the structure and the joints, joints of the dorsal joints will be free and mobile. So by that there is no muscle tightness. External support should be proper shoe, tapes, orthotics. Shoe recommendations, then there is taping called low dye taping. The name of the taping is called low dye taping. No material, so don't want to leave it. Orthosis like this, using the soft chappals. I am using insole, proper insole, right, finished. Next one, quadriceps condition. So special test, no special test. Yeah, there is special test, quadriceps contusion, right, sideline. If there is a contusion, if you do, right, knee flexion, if you do knee flexion, patient will get pain, right, where there is a contusion, maybe distal quadriceps or middle quadriceps or upper quadriceps. When you do knee flexion, you are lengthening the quadriceps muscle. Or, right, when you do knee extension, right, straight, raise your leg up, okay, down. Now you rise, up. When you do resisted knee extension, also painful. Either you stretch the muscle, it will be painful, or if you do resisted, that particular muscle's movement also will be painful. This is quadriceps contusion. Treatment you can see. So treatment applying, control pain and swelling, price protocol, ice compression. When applying ice, like this should be applied. Knee should be flexed. Like this, it will be more effective. So weight bearing and stretching, start walking without crutches when good quadriceps strength and normal gait patterns are demonstrated. Mild stretching quadriceps, pain-free isometric quadriceps exercise. Return functional strength, pain-free strengthening exercise, endurance and sport-specific exercise. The another condition, dequartance tenosynovitis. Third, dequartance in the hand, thumb. So problem of these two tendons. Which are the two tendons? Extensor pollicis brevis and abductor pollicis longus. So we can see here, these two tendons are the problem, not this one. These two tendons. This is the tendons of extensor pollicis brevis and abductor pollicis longus. Here, this is the problem. This is the area of problem. Right. So, what is the special test? Finkelstein test. Simple. Abraham, keep it safe. Right? Thumb flexed, finger is closed, then performing ulnar deviation. If there is inflammation to this tendon, there will be painful. Right? This is a special test for dequarans tenosynovitis. The name of the test is called Finkelstein's test. So treatment: eyes rest, moderate is therapeutic ultrasound, thumb spica, that is supporting the thumb. Exercise: wrist stretching, both side, thumb stretching, stretching exercise, curling the towel, towel gathering, isometric hold, thumb spica. This is thumb spica, applying this thumb. So next we are going to see. Next we are going to see hamstring. Hamstring special test. There are two special tests for hamstring injuries. So first special test is called straight leg rise test. Right? So this is rising the leg straightly up. So normal range of motion is supposed to be 80 to 90 degree, 0 to 80 or 0 to 90 degree. Pain may be reproduced. Comparisons are made between opposite legs. So point position, right? Hamstrings time. So relax, relax. Keep your leg weight to my hand. No. Keep your leg on my hand. Leave it down. Don't hold it. No, leave it freely. Leave it freely. Really leave it.
خله هو يتحكم بقى.
لا تشد خليه يرفع يديه.
Lift my leg. Lift my leg. Leave it. Leave it. Lift. Leave it. Leave it. How it is going? How you are doing? Hold. Leave it. Lift. Leave it. You are doing like this. Should not go down, okay? So put your weight on my hand. Relax, huh? Hey, you are doing. Right? So this is the test, straight leg rise test. Knee should be extension, right? Then when we are doing hip flexion, normally from here 0 to supposed to be it is 80 or 90 degree. But in case of hamstring injury, we will not get 80 degree or 90 degree. The patient will complain of pain only if you do 60 degree level. Oh, paining. You cannot do more. So range of motion for hip flexion decrease when knee kept extended position. That is number one test. The name of the test is called straight leg rest. Second, resisted knee flexion, prone. Resisted knee flexion. So passive resistance. Excuse me. Hello, Dinesh. Class, are you with you?
دائما يرتاح كده. كيف
So 1 minute.
ايه ما توقف. وقف بالله. عايز يا شيخ احتار انا من اول 7
السلام عليكم سر sir. Okay, sir, I am in class. Shall I come now? I am in class. I will take a break and come. Okay, sir. Thank you, sir. Thank you. So, just 5 minutes for meet at Mohammed Salah will come. Okay? Wait for me. Huh?
Okay, no.
Come and finish fast. Huh?
Okay.
5 minutes, please.
Okay.
I don't go. Okay?
فقدر سامعين.
That time the range of motion is supposed to be 0 to 80 degree or 0 to 90 degree. In case of hamstring injury, the patient hip will not be or cannot be flexed up to 80 degree or 90 degree. The pain will appear the pain appear maybe less than 80-degree level. So that is positive. Resisted knee flexion, prone. Prone. So same thing as I told you, quadriceps contusion. So when the muscle is contracting, that time when you give resistance, right? So stabilize the trunk, pelvis, right? Ask the patient to bend. Okay, please bend your knee. Bend your knee like this. Bend. Yes. So when you bend, when you resist the knee bending, knee flexion, so the quadriceps, if injury, that will give pain because quadriceps contracting now. So resisted knee flexion will give pain. So that is also a special test for the hamstring. So when you go to rehabilitation phase 1, ice massage with knee extension and hip flexion, perform before after exercise as soon as possible. Between exercise also you can do ice. Mild full leg compression, warp. Warp means like a bandage, crab bandage. Applying. Then static hamstring stretching exercises, tolerate 4 to 5 times. Then PNF hamstring stretching 2 to 3 times. Stationary bicycle riding with seat. This one hamstring, right? Stretching, PNF stretching is like this. One of the stretching, PNF, right? For example, tight means cannot do up, yes or no? Right? So this position, patient, right? Now, please press my shoulder, press until I tell, okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, relax. Okay, now press my shoulder, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, relax. Press my shoulder, 1, 2, 3, 4, press 5, 6, 7, 8, 9, 10, relax, don't do. So like this. This is called PNF. PNF, right? Hold relax technique. PNF stretching, proprioceptive neuromuscular facilitation, PNF stretching. So when you give pressure, when you hamstring doing isometric contraction, when you press, when hamstring doing isometric contraction, the pressure is increasing in the hamstring muscle. When there is pressure is increasing in the hamstring muscle, the Golgi tendon organ of hamstring muscle is activated. When there is a Golgi tendon muscle of hamstring is activated, the hamstring muscle will be relaxed, reflexively relaxed. When hamstring muscle is relaxing after 10 seconds, you are stretching. Next range. So keeping it next to new range, again asking the patient to press. So that time also the muscles tension is increasing, Golgi tendon organ is activated. Again muscle is relaxing after 10 seconds. Again one more new range. So like that, every relaxation you are taking into one new range. By that you are increasing range of motion. So that is called PNF. Stationary bicycle will give strengthening of hamstring muscles. Then progress to phase 2. Then there is 10 prone leg raises can be completed. So phase 2, 2 to 7 days. Straight leg raise like this, prone and raising the leg up. So abduction, side leg position and doing abduction like this, right? Then adduction, right? Then adduction, performing adduction is like this, side leg position, side leg, right? So this leg, yes, take up, take up, yes, take up, okay. No, this leg up, okay. Adduction, take up like this, down, okay, take up, yes, down, up, down. This is adduction. Right? The other one is abduction. Abduction can be done like this. Right? No, this way.
Yes,
right?
yes.
Abduction, the down leg.
Adduction.
Right? No, that is also adduction only. Adduction.
No.
This is abduction. Sorry.
Yes.
That is adduction.
Yes.
This is abduction. Adduction is like this. Up, right, down, up, down. So this one, right? Abduction, taking up and down. Take up and down. Like this. Abduction, adduction. Then standing knee flexion. Standing knee flexion, bend over hip extension like this, bending and performing hip extension. Then balls fusing, keeping ball between thigh and fusing, balls fusing. Then partial squats, slightly lowering down, not full, partial squat. These are the exercises for hamstring. Then forward step up, like this, stepping up. Then leg press, pressing the leg, weight, leg press. Then chair walk. sitting on chair and walking. You can see the picture, chair walk. So all these exercises for quadriceps. Begin interval work stationary bicycle. Interval should be given ice massage. All this. Phase 3. So continuing the same exercises previously. Then there is a high knee running like this. Knee running, high knee running, up. Knee is taking. Usually we run low knee running, but hamstring, after hamstring injury, the knee can go high running. That one, backward running. Then vertical knee progression to horizontal jumping. So horizontal jumping or vertical jumping, sprint, fast running. So all these are hamstring treatments. Okay. So after hamstring, now going into menisci. Menisci, then ACL finished. Okay.
Okay.
Menisci, you can see special test.
ACL, yeah, take this.
Special test, joint line tenderness. Joint line tenderness. Can I get another model where I can see the knee joint? Another model. This band is lifted up. So first one is joint line tenderness. Joint line tenderness. So when there is meniscal injury, for example, medial, how many menisci are there?
2.
There are 2 menisci, medial menisci and lateral menisci. So when which is commonly will get injury, medial or lateral? Medial menisci will get common
Lateral.
or lateral?
Lateral.
Wrong. Medial menisci only will get common. Why? Why medial menisci is commonly getting injury? What is the reason? There are 2 reasons above. Number 1 reason, if you see femur bone, femur condyle, 2 condyles are there, femur, the medial condyle of femur is huge, big condyle. Same way, the tibial condyle, when you see tibial condyle, the tibial condyle surface also is big. So when big condyle touching the menisci, so the weight bearing is more in medial femoral condyle. So when weight bearing is more, when there is a twisting movement, so medial menisci will get injury than lateral menisci. That's what it is commonly in sports. If we see medial menisci, anterior cruciate ligament, then medial collateral ligament, these 3 will get injury. This is called athletic triad. Athletic triad. 3 injuries together. 3 injuries together like this. Like this. Leg will be stable, but knee will go like this. Knee will go like this. So when knee is going, this side is no structures. This side structures will opening, stretching. Which side? Medial side structures are getting stretched. What are the medial side? Medial collateral ligament, medial menisci. Number these 2. One more is ACL, anterior cruciate ligament, also will get injury, ligament injuries. This is athletic triad. Very, very severe cases. No, these 3 ligaments will get injury. Right? But simple cases, maybe only medial collateral ligament, or sometimes only medial menisci, or sometimes only anterior cruciate ligament is the anterior menisci. Not listening the class. Listen, okay. So like this. So medial menisci, if there is injury, not all patients, sometimes we can feel tenderness, joint line tenderness. So how to check? So we have to palpate first the joint. So to test joint, relax. To test joint, to hold the joint, we should move the knee joint flexion or extension. So when we move it, we can find the tibial condyle. So there is the joint, then we have to palpate here, the joint line. So when you touch the joint line, there will be a tenderness. That is number 1. Right? Number 2, McMurray's test. McMurray's test, to do patient in supine position. Physiotherapist now should stand the testing side. So one hand, distal hand should hold above the ankle joint. Another one should be like this. Right? Web space should be used to hold both medial side and lateral side. Now to do this, rotate internally, then do knee extension. If patient gets pain, that indicate lateral menisci injury. Right? Same way, knee bend, one hand is here, one hand is here. Rotate laterally. Now, when there is meniscal injury, there is an injury, if it is pains, that indicates medial. So opposite. Opposite. Yes?
Oh.
Lateral rotation, medial meniscus. Medial rotation, lateral meniscus. This is memorized. Third, applies compression and distraction. Prone position. Prone. I'll do that side. No, prone. So here, to do this, we should keep knees in bending position, then do compression, then rotate. Which one? Laterally, and compression and rotate medially. Again same, the rotation. If there is a pain while medial rotation, the lateral meniscus injury. When we compress and do lateral rotation, that indicates, if that then pain indicates medial meniscus, opposite. Thing is only with compress and rotate. Compress and rotate. This is which test? This is called applies compression and distraction test. So these are the special tests for anterior cruciate ligament. So now non-surgical management, ice, rest ice compression elevation, electrotherapeutic modalities can be applied, injured joint, then muscle strengthening and dynamic proprioception, the lower limb biomechanical correction, and possible long-term bracing. So stretching exercise, you can see hamstring, this picture, how to do hamstring stretching. Then again one more hamstring stretching. Here, this is also hamstring stretching. This is also hamstring stretching. Here, the muscle hamstring is backside. Hamstring muscle is here backside, so getting stretched. Another stretching also. Here hamstring muscle, you can see this pink color, getting stretched. Then quadricep stretching, like this, supporting, taking a support from the wall, small wall or bar, then bending knee like this, quadriceps. Then again, this is one more quadricep stretching, like this, bending the knee, helping the chair. This is quadriceps, both. Like this, taking one tool, then bend it, like this, quadriceps. Then calf stretch, we know already, calf stretch for gastrocnemius and soleus. Then hip flexion stretch, so doing like this, one leg front and performing hip flexion. So this leg, hip flexion getting stretched, this leg. You understand? Not left leg, right leg. Which leg is back now? That leg getting hip flexion stretching. Here, this leg. Like this, here, now, the here is getting stretched. This hip flexion, okay? Because hip is here kept extension, but this leg hip is kept flexion, so no stretching, here only stretching. Then hip adductor stretch, adductor, this side, adduction, getting stretched, or like this also can be done, giving pressure. Then strengthening exercise. So quadriceps stretch, pressing isometric quadriceps, then straight leg rising, lifting up, then heel rising, heel rises, elevation of the heel, then leg curl, right, leg curl, bending, so here back side, pressing down, right, pressing down, that is hamstring, then leg extension, like this, up. Then balance exercise, this is called balance board, this is a wobble board, then standing single leg, all this balance exercise. The dynamic exercise are plyometrics. So like this, step up, step down, jumping in, jumping out, like this plyometric exercise. This is for power, to improve muscle power, margin, keep inside, right? So post-surgical phase 1, acute phase, day cryotherapy and exercises, stretching, strengthening exercises. Then we increase in ROI, bicycling, all this. Phase 2, internal phase. Again, this is all theoretical part, okay? No practical. Practical will be asked only exercise. So last one is anterior cruciate ligament. Special test is Latchman test. Anterior cruciate special test, Latchman test. Done at 20 to 30 degree of knee flexion. One hand stabilizes the distal femur and the other firmly grasps the proximal tibia. So a gentle anterior translation force is applied to the proximal tibia. Right on? So keep, right, 20 to 30 degree knee flexion. This situation, right, now, like this, right, or like sitting on the leg, foot leg, then here using two index finger, push the hamstring tendon up, then hold it like this, then translate tibia anteriorly. Don't forget to push the hamstring tendon up. Why? Because when there is a injury, ACL injury, there is a pain in the knee joint. When there is a pain in the knee joint, the muscles will get spasm. Like especially hamstring muscle will get spasm. What is spasm? Muscle is tight or muscle is loose? Spasm. Spasm time means muscle will go tight or weak? Tight. So hamstring muscle will go tight. So actually when ACL, what is the role of ACL? The role of ACL, it will not allow tibia to go forward, anterior. It will not allow tibia to come forward. But if this is tight, normally though there is an injury, tibia won't come front because hamstring will pull back. So to avoid hamstring work, to avoid hamstring roll, push hamstring up. Now hamstring relaxed. Now hamstring relaxed. If actually injury, then tibia will come more front. So without press, if you do simply pull, it will not come. So this is called which one? Latchman's test. Right? Keep important is knee 20 to 30 degree flexion. Knee 20 to 30 degree flexion. Next one is anterior draw test. Here knee should be kept 90 degree flexion. Knee should be kept 90 degree flexion, again same. Right? Here push and pull. Push hamstring tendon, then pull tibia anteriorly. This is anterior draw test. Anyway, pivot sit test 1 minute, then rehabilitation, acute phase. So there are ROM exercises. When you see ROM exercises, patellar mobilization. So patellar mobilization is like this, right? Here, lateral medial glide, up and down glide like this, patellar mobilization. Then calf hamstring stretching. Already you saw the pictures. Then heel slide. Heel slide is like this. Heel sliding. Drag, drag, drag. Okay, push, push, up, push. No, don't take up. Drag and go. Like this. Okay, pull. Yes. Go up, go. Like this is called heel sliding. Heel sliding. Right? Then prone quadriceps. Prone quad. No? Stretching. Prone quadriceps stretching. Go prone. Stretching the quadriceps. Right? Like this, bending. Quadriceps stretching. Prone quad stretch. Sweating, huh? Right? Then bicep exercise. Then strengthening. So quadriceps stretches. Already we saw quadriceps adduction. Then straight like SLR. Right? Then keep adduction, abduction, all these exercises. Movements. Then range of motion exercises continue. Then strengthening exercise for all proprioception, single leg balance exercises. Same, all. You have to read this. Okay? So phase 4, last phase, there will come cardiorespiratory exercises, and etc.
Finish.